Hi, my name is Paul Hobrough and I'm coming to you from my clinic here, Physiotherapy in Hexham, and I'm doing some of these videos now for shockwaveguru.com. What we're going to do is we're going to look at the different types of shockwave. Now, many of you will know that you can use shockwave on both plantar fasciopathy and also Achilles tendinopathy. So we're going to look at the basics around why we might use radial shockwave or why we might use focused shockwave therapy. So for this introduction, I'm going to start off by using, this is an MP1 machine, which is probably the most basic one you can get on the market. It's portable, but in terms of warming the tissues up and the sort of machine that most people would be using by today's standards, the radial machine is probably the safest and most used, although possibly the focus machine we'll come on to has a bit more science behind it. So I'm going to use a fairly high frequency rate here. It's about 16 shots per second, and we're going to be using this with a moving head over about 1,000 shocks up and down the Achilles tendon. You see I'm working into the muscular tendinous junction also, and we're coming right the way up over what I would consider to be the mid portion part of the tendon, which is where the site of greatest tenderness is. And by treating over this central site, by doing at least 40% of our shocks in that area, with the other 60% being on a moving pattern, I know that I'm going to warm up the whole area. So you see how I'm moving. Now with 16 shocks per second over this tendon, it really doesn't matter to a great degree how fast I move the head around as we go across. As long as when we're warming up, we're on a fairly low bar pressure, about 1.5 bar pressure for that, and we do say about 1,000 to 2,000 shocks over that. Let's just switch this off so the fan calms down. Once we've warmed that tissue up, we're then going to move on to the focus machine with standoff number 2. So the focus machine without a standoff looks like this, and then when you put the standoff, effectively what we're doing is that the focused shockwave that comes off will always be at about this distance, about 2 inches away from this end piece. As soon as we put a standoff on, what we're allowing to do is that actually we're just getting that origination of that beam further away from the skin. So it's still about 2 inches away, but we're working much more superficially. I've got a great way of showing how these standoffs work, which is on here, if you can see. This is with the standoff we're using, so you can see how superficial that goes. There's a standoff one, and then with no standoff, this area here shows you exactly how deep that focused ray is going. So, as we said, we're going for a fairly superficial treatment here because we're over the Achilles tendon. We go to that point of greatest tenderness, and that's where we're going to stay. So we get plenty of gel over that area there, and then away we go. Now the first thing you'll notice is a lot quieter. Also, in terms of the patient's sensitivity, the focus machine tends to be a little bit easier to sustain. There's little or no treatment occurring actually at the skin, so it really is just bathing that Achilles tendon. Now of course you can move it around, but previously we were on about 16 shocks per second. Here we're working on just 6. So we want to move this around a lot less. There's no problem with the focus machine working up and down the Achilles, but that point of greatest tenderness is where you want to be working. And remember, we can work from a medial angle as well. A couple of things to point out. One is I'm keeping the foot on a slight bit of dorsiflexion to make sure the tendon is under tension. What we don't want is a tendon here because the shockwave is just going to bounce around in the tendon. So make sure you've got a little bit of tension on there and then work on that central point. Now whereas we did about 1,000 to 1,500 shocks as a warm-up process with our radial, with the focus we're going to keep going for 2,000 shocks, maybe 1,500, but if the person can withstand it, 2,000 shocks. And the pressure here is working up up from about 0.1 up to about 0.25, whereas the pressure on the radial reads as bar pressure, and that would start at 1.5 and go up to about 2.7 in this machine, but you can go up to 5 on the MP100. So you're looking at a completely different way of operating the machine, much lower pressures here, but much more focused. A combination therapy of those two working on this Achilles is proven to have the greatest results scientifically and also anecdotally with our patients. So having both machines at your disposal like this is by far the best route through for this condition. In the next episode, we'll be looking at plantar fasciitis. So thanks for joining us.